Hello and welcome. Welcome, everybody. I'm so honored to be introducing you to the Birth Retreat online forum. My name is Nav Kumari and I'm the founder of SATTRA Yoga and also a prenatal yoga teacher. I'm joined here tonight by a wonderful panel of guests, each of whom have a rich experience and expertise in the journey of birth, not only within their own profession, but beyond that, from the experience of giving birth themselves or assisting in birth. Now, the reason why we all come together is because SATTRA exists to create really authentic and inspiring wellness experience brought together through creative collaborations. And I put my hand on my heart when I say the birth retreats is an absolutely perfect example of these collaborations coming into action. So before we open up the conversation with everyone, I'd like to take a moment just to introduce you to our panel. I want to start off with, first of all, Damien Mulick. Now, Damien is an osteopath and practicing functional medicine in functional medicine. And Damien has many letters behind his name, which is very, very well stated for the simple reason that he is the founder of the Hong Kong Osteopathic Association, the Stanley Wellness Centre, and also the Central Wellness Centre. So welcome, Damien. Thank you. We also have Dee Cheong, and I'm so glad that we've got these transparent masks today because you'll be able to see Dee's most radiating smile. And Dee also has absolute love for babies. Dee is also a yoga teacher and the co-founder of Floaton and SUP Yoga in Hong Kong. Next, we have Lindsay Parfit from Calm Birth, Hong Kong, offering awareness in mindful birth and in hypnobirthing. And Lindsay acts as a really strong pillar within the community, as she is also the co-host for the Mum Body Soul podcast, which she, welcome Lindsay, which she co-hosts with Ziggy. Now, I don't know anyone in Hong Kong that doesn't know Ziggy. Ziggy is the founder of Fit Mama and specializes in women's wellness and fitness. Welcome. Next, we have Corinne Conrad Calder. Now, Corinne doesn't necessarily need an introduction because her energy just says it all. And Corinne has, she works as a soul-based life coach, feminine embodiment teacher, and a birth doula. Welcome, Corinne. And we have Healy Banks. Healy Banks brings her deep wisdom, professional experience as a health and wellness coach, and her personal experience of birth, family, and parenting. And Healy does also, she's a host of the Conscious Collective podcast. Welcome, Healy. Nice to have you here. And then also we have the lovely May Nagoy. May is a sacred artist here at Five Elements who has such a giving nature and a creative mind which resonates in the yoga that she teaches and the transformation experiences that she openly gives to everyone who walks in through the doors here at Five Elements. So nice to have you with us. Welcome, everyone. So as you can see, I am completely honored to be here amongst this wonderful panel of specialists right here. And these birth retreats actually came from my own experience of being pregnant 3 times in the last 5 years. And I actually, during that experience, I thought to myself, wouldn't it just be amazing to go on a baby moon, and whilst on that baby moon, beyond the experience of what you expect in terms of beautiful location, spa treatments, relaxation, nutritious food, wouldn't it be amazing to be able to give pregnant ladies like yourselves the experience, access to, and the empowerment from women's wellness specialists from the industry to be able to help you along your birth journey with whatever questions and insights that you needed. And then also in line with that, to also receive some prenatal yoga whilst you do that. Now,
at the beginning of this year, when I was coming out of my postpartum era after the birth of my third baby, or laughingly, I should really say, when I actually started to feel human again, I actually spoke to many, many mothers throughout Hong Kong, and I asked them numerous questions about their pregnancies, their birth stories, and also what their postnatal experience was. And within this, there was such rich and deep insights, and also just like some candid responses about what they got, what they received, what they didn't like, what they felt they wanted or needed more of, or even that there were certain areas which they didn't even know that existed and they wish they knew in the first place. So all of this information creates the foundation of what is creating these birth retreats and what we are offering to all the pregnant ladies out there that are able to come and join us. And because nobody's jumping on a plane and nobody's going to a baby moon, and nobody's, hopping to a exotic location, I'm so blessed to be offering these birth retreats here at the beautiful wellness sanctuary of Five Elements Habitat, whereby we're cultivating and building this community where women have an access to this open community of other women, but also to each one of our specialists that they can speak to be able to help them throughout their journey. So without further ado, I actually want to open it out to the discussion out to everybody here right now. We have many, many questions, some of which you have yourselves contributed to, and we'll try and get through as many of those as possible. So I actually want to start off my first question to yourself, Damien. So Damien, you treat many pregnant patients and have assisted in the birth of even your own children. Yes. So during pregnancy, so many physical changes occur. And as a woman, our bodies go through constant transformation. What would you say are the most common physical treatments in your wellness practice that you treat pregnant patients, and what are the causes for these issues? Over to you.
Okay, be careful. Okay. So just to say, again, I'm an osteopath, and I just see a lot of pregnant women, like you just said. It seems to me that there's different types of changes, whether it's your first child or your second or third child, of course. But all the changes are always quite similar. They're always related usually to the burst of the hormone relaxin that's going to soften the tissues, soften the ligaments, allow for the body to go through those mechanical changes to facilitate the birth, of course. You often see that when the woman starts changing, the breast gets bigger, the posture drops a little bit because the front of the body start pulling downwards, because you can see the uterus gets bigger and there's a massive pull towards what we call the pubic symphysis at the front. And when the relaxant kicks in, which is usually around 12 weeks, 22 weeks, and 32 weeks, I've found that from personal experience, there is a very quick shift in the way the pelvis is going to open laterally. There is a quick shift in the way the body is going to drop, because the breast is going to get bigger and the shoulders are going to drop forwards. And the women usually try to hold their weight back by just putting their hand behind their back and try to just maintain that lumbar curve to also assist the sacroiliac joints. Because one of the common problems that we see, the most common problem, is that when the pelvis opens up, the sacroiliac joints become a bit unstable. And when they get a little bit unstable, they can create pain such as sharp pain in the pelvis, sciatic pain. They create pain at the front in the pubic symph area. And the women usually start feeling it when they walk, and they start walking a little bit sideways to just offset that. The other thing you often see is the lack of lumbar lordosis. So the body slumps forward, like I said. It compresses the diaphragm, puts some pressure in the middle of the back, and there is not enough space to open up. So this whole pressure dropping forwards creates back pain, creates breathing difficulties, especially when they're on their back. Like women, they're on their back, the baby usually presses on the inferior vena cava so that they get shortness of breath, but it's also due to the fact that the diaphragm is quite compressed at that level. So they have back pain, pubic symphysis pain, sacroiliac pain, and difficulties breathing, which can create subcostal pain too, just under the rib cage. These are the main complaints I tend to see in practice. There are other complaints from pregnant women. Yeah, but these are the main ones. Yeah, the classic ones.
Brilliant.
Does that answer the question?
Absolutely.
Okay.
Do you know what? That's absolutely brilliant. And do you know what? Can I just say that when I met and spoke with Damien about my own birth, my birth story, Damien, you're amazing, because when I told you the action that I took when my baby started coming out, Damien actually described anatomically everything that happened to my body, my ligaments, my muscles, my joints, even where my fallopian tubes were at that particular moment in time, which I just was like, it was just phenomenal. So thank you very much, Damien. Brilliant. My next question goes to Ziggy. And so whilst we're still on the realm of the physical body, I wanted to ask you, why do you see it is important for mamas to stay active during their pregnancies? What are the benefits of an active and healthy body for birth and beyond? And how long or soon after birth should they consider physical exercise again?
Hello. Hi, I'm Ziggy. Just off the back of what Damien was saying, we also tend to notice that kind of posture in more sedentary people, and the majority of people who are pregnant, they're usually working up until 38 weeks in Hong Kong, and they're sitting in that position. So most people have quite a sedentary lifestyle, and being pregnant, living an active lifestyle, or just moving is really important, not only for your postpartum recovery later, but for your birth as well. Birth, believe it or not, is a very physical event, and you can liken it to, we don't know what you're going to get, but you might get a marathon or you might get a sprint. So let's prepare. Let's prepare the body physically. Let's prepare the breath physically as well. A lot of the birth process has a lot to do with breathing, but also mindset. So if we think about a physical act, a race, even just doing sets and reps at the gym, it can be a bit of I want to say an F-bomb, but I'm not going to say the F-bomb. It can be a mental challenge. And so we want to train that during pregnancy as well as for birth. But that doesn't mean that it has to be a really, really tough workout every time you're going in. Pregnancy is all about listening to your body. Usually we take it in stride each session to see how mama is feeling. And then when we go into the postpartum phase, to answer your last question, is that ACOG guidelines say that we have to have our 6-week checkup. So with a doctor, your 6-week checkup is going to look like, does this woman have any postnatal bleeding that's an issue, any scar tissue that's an issue? Can she physically leave this room and her uterus isn't going to fall out? It's not an in-depth check to the extent of, can this woman run? Can this woman lift with load? And so what we do in pregnancy training is we mimic movements that you're going to be doing postpartum as well. Lifting car seats, lifting your child, bending down, squatting, all of these things that fall into functional movement. So minimum 6-week check after a vaginal delivery and cesarean to make sure that everything's healed and nice. And then I always recommend going to see a pelvic floor physiotherapist for a more in-depth check to check the degree of abdominal separation. And then once you have that, then we can go into a rehab phase of postpartum training. But at the end of the day, once you've had a baby, the most important thing is you and that baby. So in those early 6 weeks, walking, getting in and out of bed safely, establishing good breastfeeding if that's your choice, and rest. Rest is the most important postpartum.
I just felt that it's so important to stay physically, active throughout pregnancy. And yes, such good advice for after, because there's so many women out there like, right, want to get straight back into my pre-body. And what you said was quite interesting with regards to mindset as well, which brings me on to my next question, because I think the one way I kept my mindset in good frame was that I actually, I did meditate throughout my pregnancies and breath work as well, because I just felt like it really helped nurture my journey. And so, Dee, I wanted to ask you, from a mindset perspective, how do you feel the impact of the grounding methods that you used throughout your pregnancies worked for you, and how do you feel that they are so important for any women out
Okay, so I would say that for me, my grounding practices around yoga and meditation, I mean, these are things that I've cultivated for years. And for sure, I didn't realize how important it was going to be when it came to my pregnancy. And that, it's something that was in my toolbox, but it's also just a habit. And I think it's important to fill your toolbox, especially now, in the times that we're living in, to be able to pull those things as soon as you need it. And it's not just in birth, right? It's when I'm faced with, a challenging task, when it's at work, or if I have to, I'm faced with a problem. I know that there are things that nobody's gonna tell me, how to change my mindset, or how to calm down, or how to just clear my head. But these are things that I know that I have in my toolbox, and I can just pull from there.
Because I know, for instance, like, it doesn't matter how independent you are as a female, no matter how strong-minded, no matter how like strong your vision is in life, when you're pregnant and you've got all these hormones and the emotions, you almost don't feel like yourself. So having that toolbox, I think, is just absolutely essential, just to keep yourself and just in a good place, not only for yourself, but if you've got any other toddlers, and obviously your partner as well. Exactly. So Corinne, I think this leads me on to you. During pregnancy, and as I just mentioned, where I had like such an influx of emotions, I also felt that my instincts shifted into protection and nurturing modes, and sometimes even to levels of confusion that I wasn't really able to. No, it's true. I wasn't actually able to articulate, how I was feeling all of the time. How do you feel pregnant women can benefit from feminine embodiment practice to help them with their vivid and complex feeling world?
Yeah, well, I like that you talk about, that it was sometimes hard to articulate how you feel. And I think whether you're pregnant or not, I think as women, a woman who feels a lot, I think we all feel like that sometimes, and, I think there's a place for understanding and examine and being able to articulate what you feel. Absolutely. Like, I would say, if a woman is going through recurrent, emotions of being fearful about, let's say, a very common one, fear of sensation of labor, then this is something to be looked at. This is not something to be pushed away. It's something to be examined and worked through with a practitioner who specialized in that. But I think what you're talking to is, these emotion, like this cocktail of emotion that women experience during pregnancy, and especially postpartum as well. And with these sort of feelings and emotions, I think what's important is that women have an opportunity to just feel, like to make space to feel, and to not actually understand every little feeling and every little emotion that they're going through. And that kind of brings me to, feminine embodiment, because one practice of feminine embodiment is intuitive movement. And when I, guide women through intuitive movement, first, it's all about just welcoming and accepting how things are right now, with all these different feelings. And feelings, I mean, like it can be an ache in your body, it can be an emotion, it can be a thought pattern that keeps coming back again and again. So the first step is kind of just like welcome it all in. And then the next step is to actually move it and to give it space through, stretching and dance and deep breathing, making soft sound or crazy sound. Yeah. And all of that, we do when we kind of help women to kind of go more into that intuitive movement. Now, that is not just important for, pregnancy and postpartum. It's actually very important for birth again, because when a woman goes through labor and birth, there's such an energy moving through her body, which can be, again, emotions, sensation of contractions. And one of the best way to deal with that is to be on all fours or upright and move your body, like just feel into what creates space right now, and make sound and express. So that's what women find very liberating often, not to actually understand what they're feeling and to articulate what they're feeling, but this more like non-verbal way of just being with what is. Yeah, so that's how feminine embodiment in that way can help women. Yeah.
I find that truly, truly insightful, because we do live in a world where we're always trying to define things. And I suppose that's me saying, no matter how strong you are, and no matter how, how strong your vision is and what where you're going in life, sometimes we just need to surrender and just let go and just be. And we forget that, we spoke earlier about, working all the way up into 38 weeks pregnant, you're in that work mode, everything's so rational and logical. I love that. It just hearing you just made me go, oh, just let go and surrender. And I think one of the things that happens also is during our pregnancies, we get told numerous things like, tales about what you should eat, what you shouldn't eat, you shouldn't sit on the floor, you shouldn't do this, da, da, da. And I think one of the things for me now in the birth retreats themselves, one of the first things that we do is we arrive and we are introduced to a tea ceremony meditation in order to come from the outside world and become grounded. Now, I know that one of the things that I had in just the preconception was that not to take in any stimulants, and one of those would have been caffeine. So I've got a question for you, May, on a very practical level, where you'll be offering tea at 5 Elements as part of the birth retreat. I just wanted to know, would you be able to just describe to everyone, just to clarify the properties of the tea, and if anyone else had any of these concerns about caffeine and stimulant?
Thank you so much, Nav. And I just want to express some deep gratitude and appreciation that you would choose to host these amazing people who I cannot believe some haven't known each other before. It just seems like we're all resonating on the same frequency. Also, 5 Elements Habitat really could only dream of welcoming something like this, especially at a time in Hong Kong where, we're so far away from our families. I cannot even imagine being pregnant at this time. So to be able to offer them some sanctuary, really, thanks for thinking of us. I met Nav in the tea space, actually, and she kept returning again and again. We've shared maybe 100 bowls of tea, who knows? And, the question that she's asking is to express the properties of the actual tea. And after a tea ceremony, if somebody asks that question, like, what is in the tea? My teacher, the way he answered that question for me, when asked what kind of tea are we drinking, the answer is always, it's the kind of tea that warms your heart. So in terms of the actual caffeine part of it, I'd say that the stimulants in tea, tea is the second most consumed beverage apart from water in the world historically to this date. And 96% of all tea is enriched with chemicals and things that are not healthy for you. So we can't confuse what is actually unhealthy for these certain stimulating drinks, such as like tea and coffees. The tea that we serve is sustainable, clean, and living tea. That means is there's absolutely none of that extra added stuff. So what it thus becomes is an actual medicine. So, we say we do these practices to reconnect with nature, but what we're really doing is awakening to the fact that we are nature, we are stardust, we are the chi in itself. So what we're actually feeling is actually we're sensitizing ourselves. So we're actually removing the stimulant and having a chance to actually feel everything that's going on. And I can't even imagine women, especially first-time mothers, I can't even imagine them in that ceremonial aspect, to be able to sit in the presence of all the other, because you do feel like a majestic queen in the presence of a majestic, purified plant. I've had a chance, the ones that are nodding greatly are the ones I've sat with tea. And so I'd say that the medicinal part is actually, calling in the rewilding of the forest within us. And it's an intuitive thing. It's something so deep that after the embodiment, then we can allow ourselves to go so deep into the subtle layers. And you feel, there isn't a day that goes by. Every day is a profound sharing. We usually share at the end. And even today, every day, we were discussing, we were relating how mushroom spores, they have survived billions of years, and how that through the tea, somehow when we share at the end, we're often saying the same things, like, why is it so telepathic? Well, we do believe that, we share that same interweb through our vibrations with each other, just like maybe we relate it to like macrocosm, but in this realm, it'll be like our tiny cosm, to be able to communicate deep in those layers. So I can't imagine, I can't wait to experience that with you all.
Carrying people along. Thank you so much. I actually don't drop the baby. When it comes to tea, one of the key things that I always have to kind of pinch myself and say is, I don't remember my life before tea. Yes. And I actually didn't discover tea when I was pregnant. I so wish I had. But since then I have, and it is an integral part of my life and how I live. And I think there's really a strong engagement to be had with tea from the natural aspects, as what you've described as well. So I'm so excited that here at Five Elements we're able to offer that as part of the retreat. So I wanted to go into the actual phase of birth itself. Dee, I have a question for you. Inevitably, one of the looming factors that on any pregnant couple's mind would be at this particular moment in time in terms of the impact of COVID itself and what that will have on their birth experience and also their hospital experience. Now, as you've had this firsthand experience yourself at the very beginning of the influx of COVID here in Hong Kong, I wanted to ask you, what are the words of advice or wisdom that you would give any couple going through this right now?
So yeah, I think I want to just give a little bit of background into my actual birth. Is that I was 41 weeks pregnant with my second child and going into the public hospital because it was close to home and it is, the best place that you could be if anything goes wrong with your child. I was going in to get induced. So, I had my bags packed. I was like, hey, what's up? Let's get this baby thing going. And this was right at the height of COVID. And, Hong Kong having the experience with SARS, they quickly adopted the same guidelines, which were no partners, no visitors in the labor ward, in the delivery ward, or the postnatal ward. And that's what we literally walked into at like 9 a.m. And I think my one piece of advice, and I mean, it's changed so quickly, and I think that's such a beautiful thing about Hong Kong, and the way that the city has adapted to it and has come out pretty well, that we could even be doing something like this, is get informed. You know, whoever your medical practitioners are, go and ask all your questions, you know, and go seek other opinions if you need to. Go and reach out to your other community of women who are pregnant and ask them, you know, because I know for myself, I was in a group of 80 women in this time where we were all giving birth, and it was right before and right after and during, and it was, you know, a lifesaver. It was a lifeline to be able to share and to know what options we had. And I think I probably would have still birthed the same way. I had an incredible birth experience. Unfortunately, my husband couldn't be in there, but I think that's where the practices for myself really came into play. And, you know, things worked out. I came out healthy. I came out with a healthy baby. So that's also, when we talk about mindset, I think that's so important to think about, is right, the end goal, right? Ziggy, you talk about the marathon or the sprint, the race, right? However long or short, is like, okay, the goal is to finish healthy together. Yeah.
Thank you so much, Dee. And I think that also comes back to what we were talking earlier about surrendering. We always have this, we have our birth plan, we have what we want to work out, but there's also an element of just knowing that we need to give space to surrender, to allow what will happen, because, you know, things are constantly changing in Hong Kong, in the world, and we don't know what that experience will be when we arrive at the hospital. So the mindset is just absolutely key. I'm going to move on to you, Lindsay. And I mean, first of all, personally, I practiced hypnobirthing throughout all 3 of my births. And what that helped me to do was it helped me to have the 3 100% natural, unmedicated births that I dreamed of. And so for me, the actual breath is just phenomenal. And I remember going into the birth ward, and there was one lady, and she was in such a way that I was just like, okay, I'm having a contraction, but I felt like going up to her and say, right, now let's do this, you know, because those lessons of hypnobirthing are just, for me personally, just essential. So can you explain how the body reacts when we learn to control the breath, and why the breath is so important during birth?
Thank you, Nav. So I think everyone can hear the thread between all of us, which is that you can't walk into a breathwork hypnobirthing class one time and then walk out and never think of it again and then go have your baby. It's a practice. It's a practice that you need to, you know, change from deep within you. And breathwork, like I think it was Dee that said, breathwork is for life. It's forever. And I was so grateful to have that in my toolbox as well when I gave birth. So it's really important that that's something that, first of all, you invite in as a consistent practice in your life. But how the breath works, and it combines itself with many things. There's lots of aspects to hypnobirthing, but with the breath, essentially, it's calming down our nervous system. So we have a fight or flight response in our body when something is stressful or we have a fear reaction to it. And so when that happens, and when things don't always go to plan, I like to call them birth preferences, not a birth plan, because the path can take, as Dee experienced, many different directions. When things take a direction that is unexpected, you may have that fight or flight response, or if you have your own personal fears and anxieties that you haven't dealt with along the birth process. And breathing is one of those things, many things that we can do to recruit our parasympathetic nervous system to slow everything down. Essentially, it's going to help calm everything down. On top of helping you to control, because actually I often get a lot of women saying, I got to a point where I lost control. And they always say it feels like it was from the breath. They can't breathe, they lost control. So it helps you to feel like you can maintain a part of control. No matter what happens in your birth, no one can take your breath away from you. You have that tool no matter what. So that's why I think it's one of the most powerful things. And then it can slow you down, regulate you, and also get that blood flow moving, everything moving nicely within the body as well.
Amazing. No. And breathe. Oh goodness, actually I should have left this with you, but so I just wanted to ask you, Linda, can you explain for those of who are unaware of what mindful birth is, what is it and how it benefits the process of birth?
So mindful birth was something I was introduced to when I first started as a prenatal yoga teacher. And it was the idea that we are encompassing a little bit actually what, and we're both yogis, so I think there's like this overlap with what we do, is that you're implementing it in all aspects of your birth in terms of being very aware and informed. It's a sense of being empowered for your birth. So what that means is we're not letting birth happen to us. We're not just going in and saying, I'm just going to go with the flow and see what happens. And it's okay to have an element of going with the flow, but with your own tools to control it. So what that means is learning your options, speaking to your care provider, speaking to one of the many specialists here about how you can arm yourself with knowledge surrounding your choices so that even if your choice is not possible for whatever reason, you've asked the question and you understand, okay, I'm not able to do that, but what are my other options? So it's being part of the birth process, being aware of what you yourself can do to have an active, we call it an active mindful birth.
And I feel that's so relevant. There's so many women out there that, you know, it's almost like nobody can tell you or teach you, or, you know, some of those things that are intuitive to you when it comes to pregnancy, birth, or even postnatal. And I feel like, you know, it's all the inquiry. It's not only the inquiry that we have and the reason why we're here tonight and for the future birth retreats, but also the inquiry into yourself to be able to remain mindful in that process. And the actual process of birth, I found personally, you know, you have this moment, you were pregnant, you have this baby inside you, it's growing, you're learning all about it, you got the app and it's telling you what's happening on a month-to-month basis. And then afterwards, there's a baby in a crib where you set up the nice and all the family are there, etc. But then there's that bit in the middle, that bit of giving birth, which is so ambiguous, you know, and there is so much fear and I hate to use the word, but there is levels of anxiety that is drawn up from that. So my question to you, May, is that during birth, it is so common for women to want to give up at that very final moment, just before they're birthing their baby. What are the words of wisdom that you would offer any woman in those final moments when everything feels so immense?
Yeah, so we, as first-time mamas to be, we talk to as many people as we can. We watch all the videos. We obsess on YouTube, and we try them all. We try all the options out, like everything under the sun, like orgasming your baby out, having the water baby, having, you know, the calm birth, hypnobirth, all of it. I tried all of those things on, but you never know what's going to happen in the moment, right? And I was determined to have a natural birth. I just decided, and then even though on the inside I was regretting it so much, my ego was like, too late. You told the whole world already. So in the moment, I was there, and, you know, no one can prepare. It's not pain. It's no one can prepare you for it. It transcends all, and you're just in it so deep. And I remember, of course, husband, and you're just like, go, be gone. You have to, no, but I was like, this is insane. I'm going to die. She's not coming out. What am I going to do? And so I told myself, didn't plan it, but I told myself that your daughter is going to save the planet. And she literally at that moment, and then that became my thing. That became my one line to a lot of friends that we know, like when they were pregnant, it was the one thing I told them. I said, look, this is my one pearl. And then they'd have their baby, and then they tell me, I did that and it totally worked. And so it works. Hopefully our kids save the planet.
Yeah. That is absolutely brilliant. I absolutely, I totally wish that I'd had that pearl of wisdom from you then, because when it came to my third birth, I actually, what we thought third baby is going to be a sprint turned into a marathon. And literally an hour before she arrived, I literally got up and said to everyone, forget this, I'm going to bed. And I literally left the room and I got into bed and pulled the covers over and started falling asleep. Obviously contractions in between. And then eventually she arrived, and it was really like, you know, and it was an indirect way of saying she's going to save the world. But honestly, such strong words and such strong intent as well. So it's brilliant. So my next question, actually, one of the key things that was really coming up amongst women and mothers that I was speaking to was in respect to the whole postpartum era, that it was one of these kind of, like, it was like everyone was like, you know, as you say, during pregnancy you're reading all the stuff, you're talking to the people, but during like it was the postpartum, they didn't know what hit them. And a lot of them were just telling me, saying, if only I knew, or nobody talks about it. Why doesn't anyone talk about it? So one of the key things that we will be offering in the birth retreats is to actually spend some time to talk about that postpartum. So even though a lot of the retreats are going to be attending during your pregnancy months, it will be preparing you for those postpartum months as well. So first of all, my question is to Damien. So during postpartum, as a new mother, we are so conscious of all of the checkups, the care we need to give ourselves and our newborn baby. And all of this can be pretty overwhelming on top of, you know, everything you're feeling anyway. So why is it important for a mother and newborn to visit an osteopath, and what are the treatments they would be most likely to receive?
So firstly, most of the women I see who have come see me postpartum, most of them have seen me before, while they were pregnant. So I've kind of explained to them, you know, just not too much, because as you say, everyone's got a different journey, but I say to them, there's a rule of 3 days, 3 weeks, 3 months, and 3 years. The first 3 days, if it's your first baby, it's like whether it's your husband, you, or everyone in the household just panics, right? Then everything settles, okay? And it's the next step is after 3 weeks. It feels like mother, child, husband, everyone has found their place in what they need to do. That's when I tell the women, I said, listen, don't worry about coming to see me straight away, especially if it's your first one. Just find your marks, find some semblant of a routine with the baby. Just learn how your body's working, breastfeeding, everything that, you know, putting the baby to sleep, just spending time with the baby. And then when you've settled after 3 weeks, you come and see me. And I say to them, firstly, what I want you to do, I want you to come and see me as a patient. I want to see you, not your baby. I want to see you, because I want to treat the mum first. Okay, that never works. They always come with a baby and they say, I want you to treat the baby. And I say to them, you know, it's like in an airplane. They always tell you, put the mask on the mum, and then it will be easier for the baby, right? But eventually, the second time, mum, they are better and they understand that. But the first time, mum, they want to know, they're anxious. They want to know if the baby, they need your insurance. Is my baby okay? Because when you're a first-time mum, postpartum, you just think you look at your baby all the time, think, is the baby okay? Is the baby okay? You don't know, you know. You panic. And the dad comes, gives his 2 cents words. Is the baby? Your baby's okay. I'm like, oh, baby's not okay, you know. So everyone needs reinsurance. They need to know, you know, what to do, what to start. When I see them, I just try to treat the mum, or I give usually some little explanations to the mum of what's going on in her body, how she feels, while I treat the baby. I do both at the same time to make sure that, you know, because if I do that at the same time, and the mum's nervous system, the parasympathetic kicks in, then the baby's parasympathetic will kick in at the same time. And you get that energy in the room where the treatment is given to both mother and child, going through the child on its own. To be more specific in terms of complaints, I go to the diaphragm straight away, because the breath has taken a beating. Okay, because sometimes they held it, like not every woman knows how to breathe through the breath. They've held it, and the diaphragm contracts, and diaphragm gathers power to push back out. because the diaphragm is attached to your hip flexors, your psoas, and the contraction is from the diaphragm to the hip flexors straight through to squeeze the uterus. So you treat hip flexors and diaphragm first, but never before 3 weeks. Usually, I tell that. When I check the baby, I do a general pediatrics check, checking the hips, checking the spine, checking the neck, and looking at any asymmetries. A lot of babies have got lots of asymmetries, like the clavicles, sometimes it's broken, no one's picked it up. The neck is sideways and they've got a bit of torticollis, that the skull is totally deformed, it's just like twisting one way or another. It's okay. You check and you tell them this is what happens, you tell them how malleable it is, you tell them you can fix it, because usually I can fix it, and you just reinsure them, and then the baby, you can see it on the table straight away, the baby opens up and it self-corrects. It's within like 20 minutes, very often. The third thing I check and with the babies is all the reflexes. So I usually check with my little finger, just put gloves on and check on the palate that there's a good suction. Because your suction is good, it will explain and say, okay, breastfeeding should be fine, they can latch on, because sometimes they've got breastfeeding issues and the problem is the latching on mechanism hasn't kicked in, which you can also fix by just treating cranially and opening up the back of the skull. There's lots of more I can talk about, but I'll leave it to there. These are the main, that's why I check that with the women and the baby before I send them back to the physio for perineal rehab, for checking the pelvic floor, for checking the abdominal. I do all that too. But then I get to specialists to just really focus on that, do some specific exercises to prepare them to go back to exercise.
Amazing. Yeah, I do feel that like the treatment and just the checkup for the mother is super important. But I also remember with my baby number 1 and number 3, they did have the craniosacral massage, and like it was like magic. It literally was like my baby had been crying for like 6 weeks, and then all of a sudden she just wasn't crying. It was just phenomenal. And so, yeah, for me, it was like it saved my life for that first part. I have a question for you, Heaney. I remember after having my first baby, and part of me was very eager to get back to my original size. But I also knew that my diet would impact my recovery and with breastfeeding. So I want to know from your experience, why is nutrition so important for postpartum and also during confinement?
So first of all, I guess I have to explain what confinement is, just in case some people don't know, but it's a traditional practice in a lot of Asian countries. So for me, my family's Chinese, so I felt really called to really dedicate my 4th trimester in confinement for 40 days. And what that looked like, a lot of it was around what you put in your body in terms of food. And in terms of nutrition, I mean, to be honest, what we eat during recovery is so important for any physical recovery, and giving birth is no different. So with Chinese recipes, they're all designed to help you heal. So I found it so fascinating that there are certain ingredients on its own can help with blood circulation or lactation or bringing more heat into your body so you're not in this cold state, which is very important during confinement to never be cold. But a very common dish is a pork knuckle. And what pork knuckle, the properties it has on its own is that it boosts your milk supply. But when you pair it to ginger and then black vinegar, it really helps with your entire healing throughout your body. And it keeps you warm. It communicates with your body that, you know, you're in this healing, rest and recovery state. So I understand that a lot of people worry about their diets as soon as the baby comes out. You know, you worry about whether or not you're going to fit into your jeans. But there's a Chinese expression, 40 days for 40 years.
and how a mother spends the first 40 days after giving birth shows up in the next 40 years in her health and her well-being. So I think instead of focusing on, you know, how to get back into your old body, I think use this time to honor your body, to thank your body for growing this baby quite effortlessly. You know, all we really need to do was to eat the right foods, to move, to be positive, and it did all the hard work. And to use this time to rest and recover and support our body while it does its magical healing.
That is super insightful, because there is like so much of that world that I personally have got. I don't have reference to it or an experience with it. So, and you know, some of the most simplest things are some of the ingredients that you've just mentioned that just can make such a dramatic difference, and also just ease that experience during postpartum. And I love that, and I think that would be super insightful for everybody. Corinne, so in the women's temple, it helps to build strong connections between women. Can you give examples of how they would do this and what they would expect to experience?
Yeah, well, I think first of all, you know, women who go through pregnancy or postpartum periods, they go through a very unique time in their life. And, you know, women, because of that, find it just nourishing to come together with other women who go through the similar, the same transition, but obviously everyone a little bit in their own ways. So like what, you know, Dee said earlier with the moms group, you know, information sharing, that is one way to connect with other women. Yeah, there is, you know, breastfeeding, you know, groups, nest groups after the baby's born for the postpartum period, where women come together and talk more about breastfeeding. Yeah, and all of that is extremely nourishing and important. Now with the women's temple, what I create as an experience for women by taking them through different practices. And all these practices, you know, they're either designed to help women to get more into the heart mind, get more into the womb space, get more into their feeling world, like I spoke about earlier. And by doing that, whether it's in groups, in pairs, or even by themselves, a woman comes to a very honest place within herself and a wise place within herself, which sometimes is difficult to access alone. It's actually easier to access together with others. Yeah. And then engaging from that place with the different women that come to the retreat or to the women's temple, you know, there's just this immediate, honest, sacred, I can't name it otherwise, connection. You know, it's just there because we listen to each other, we, you know, celebrate each other, and we're not there to fix each other or to change each other, but just kind of supporting each other in that experience in whatever way every woman is experiencing that. Yeah, and so that leaves women often, you know, later on wanting to meet outside of temple. Women become friends. You know, my closest friends here in Hong Kong came out of me creating women's groups like this, you know, 5-6 years ago. I mean, I met May through Women's Temple. Yeah, and yeah, during pregnancy and the postpartum period, you want to have these sort of connections with women where you can be real and not kind of like pretend or having to pretend to have a perfect life. And yeah, that makes all the difference.
Again, super insightful, and I think it is the community. And this is basically what we're trying to do here, is to glue together that community for sharing, for just open-mindedness and just non-judgment, really, and just be able to be comfortable within that. Heaney, I have another question for you. Postpartum, which we also know as the fourth trimester, brings with it a whirlwind of newness, challenges, transitions, and hidden expectations. Beyond all of this ambiguity, what is your most memorable and happiest part of postpartum life?
First of all, can I thank whoever asked this question, because it really took me down memory lane and it got me so emotional. The most memorable moment I remember from my 4th trimester was having my son lying on my chest on my bed, and we were doing skin to skin. And I remember telling myself, you have to just be so present right now and absorb everything. And I remember looking at his head. I started looking at all his hairs, like his hairs down his back, his tiny little fingernails. I started to notice so much about him, and I was so full. And I don't think I've ever felt that way. But the happiest moment for me, and I'm very lucky because through my 4th trimester, I actually have very happy, magical moments, because I had my mom and I also have 3 aunts, and they were on rotation to come over to support me. And I can honestly say that I felt so mothered, and that was exactly what I needed. And they all came, they planned it so that they don't all arrive to my home, and I have to be like anxious about, but when they came over, they would just make me rest. And they would literally make me rest. Like, they're like, just go into the room. I'm like, I don't want to nap. It's fine. Just close your eyes. Just see what happens. I've got this. And once I started to let go, it made me realize that they were my village. And my bond with my family has become so strong throughout my 40 days with them. So, yeah.
Can I just say that that story in itself just gave me goosebumps, because it and almost quite emotional as well, for the simple reason that, like, I remember those moments with my baby or babies, that those days just after giving birth, and just lying in bed with your baby and just being, was just the most beautiful experience as well. And also with myself, when I arrived home with my first baby, my mum opened the door. She had just arrived from London, and it was like being back at home. So getting that family support, and also, the mother's community, etc., is just so important and so vital. I know there's certain times within our pregnancies and even postpartum that, things can get a little bit overwhelming, and we do need a little bit of isolation. We need our time, but there's like a really nice balance of just making sure family, community, and you time, and you and baby time, is so important. We are coming towards the end of our online forum, and I have one final question, and this one goes to Ziggy. So Ziggy, when a new baby arrives, all eyes are on the baby. Why is self-care so important for the mother to nourish, heal, and gain vitality in her 4th trimester?
Just off the back of what Heaney said, I think you kind of put it perfectly. The birth of a baby brings the birth of a new mother, and we the mother will learn is that she's the centerpiece of the family, and a mother's energy cascades out into the rest of the family. So if mom is souped up, she's got her life mask, her oxygen mask on, her cup is full, everyone else benefits. Happy mom, happy baby, happy wife, happy life. Happy life. To keep it short and sweet, but look after yourself.
Thank you so much. Honestly, it resonates, and the energy just transcends and vibrates on so many different levels. I am afraid we are out of time today. Some of you may have been sending your questions in, and we will definitely keep the dialogue going, and we will definitely be answering all those questions. But I am I mean, all of this of what we've heard tonight has been so truly insightful, and it comes past the place of our professional being, but you know, I've just felt and seen so much compassion just come out from all of you, and I'm so excited for pregnant ladies to be coming and experiencing you firsthand in these birth retreats. So if you are interested, the birth retreats, just to give you a quick overview, you'll arrive and it's a half-day retreat. On arrival, as we mentioned earlier, you'll be receiving tea offered by May and also Resham here at 5 Elements. That will be followed by a topical workshop by each one of our specialists on each one of the different retreats. That would then also be followed by myself with a prenatal yoga session, and then end with a plant-based, nutritious 3-course meal here at the Sakti Elixir, which is, I think some of us had that for dinner as well. Absolutely brilliant. If you do want any more details, they can be found on the website at sattrayoga.com/birth. Apologies. I will send this out as an email afterwards to everyone, and also the Instagram handle of Birth Retreat. But I would just like to say, on a final note, thank you so much for every single one of you. This, by the way, is just the tip of the iceberg. There is so much more knowledge, expertise, and compassion that comes from here. And also to 5 Elements Habitat for hosting such a great retreat here in their beautiful wellness sanctuary. I call this my third space, and it is really a blissful place for pregnant ladies like yourself to come out and experience. So thank you. Thank you. Thank you.